Good to be back at Temple, and Michael, thank you for your leadership. Speaking of leadership, Temple University is blessed to have John Fry as its new president, a terrific leader who I know cares deeply about the students at Temple, cares deeply about your healthcare system, and I think is going to lead Temple to even higher heights. I'm a homer when it comes to Temple. Both my parents went to Temple. This is a vitally important institution, not just for Philadelphia, but for the Commonwealth of Pennsylvania. And I want you to know we fight to make sure Temple gets its fair share. And in that fight, I'm always joined by a cadre of folks from this Philly region who do a hell of a job for you. Some of them join us here today, and I do want to mention them again because these are important folks in the community who are fighting for you. The newest member of our delegation from Philadelphia, Representative Sean Doherty from Northeast Philly, is here. I want to thank him. I want to thank Representative Jose Giral. He is the man. I mean, this guy works on a whole lot of different things, does a great job. Jose, thank you. Representative Joe Hohenstein, who really does wonderful work for Temple and the Philadelphia area, and Representative Derisha Parker, who's now besties with the First Lady of Pennsylvania, my wife. They work together to make sure that now in every single public school, public college, public university, and state park, women's pads, tampons, and all kinds of other menstrual products are now available for free for women across Pennsylvania. That's real leadership, and we appreciate you. And you'll hear from her in a moment, but Secretary of Labor and Industry Nancy Walker is with us, who does amazing work as a member of my cabinet every day, and I'm grateful for her leadership. You know, here in Pennsylvania, I think we have shown that we know how to come together and solve big problems. And I should note for the record that I'm one of the only governors in the entire country with a divided legislature, a House led by Democrats, a Senate led by Republicans. So for us to solve problems, that requires us to get Democratic votes and Republican votes. It requires us to meet in the middle, and it requires us to be bound by the most important thing, common sense. And we find common purpose through that common sense. We've been able to work together to deliver real results and make a difference in Pennsylvanians' lives, to address the serious challenges with practical solutions to make their lives better. Working together over my first 2 years as governor, we've been able to lay a really great foundation to be able to build off of, whether in the healthcare space or workforce space. But we've got more problems to solve, and I know this group and I are hungrier than ever to go out and continue to fight for the good people of Pennsylvania and solve these problems. So here today, I want to talk about one specific problem, and that is workforce shortages. It's important to note workforce is really different than employment. When it comes to employment, we have record low unemployment. This morning in Pennsylvania, more people went to work than ever before. We're doing quite well when it comes to our unemployment rate and getting people to work right now. So when we think about workforce, we're thinking about tomorrow and the next day and the next year and the next decade, and making sure that we have the people necessary to fulfill the jobs that we think are critical in our communities. Critical jobs like teachers and cops and firefighters, and yes, nurses, who provide an unbelievably important function in our work every single day. And so we've got to work together to build out our workforce. The budget that Michael referenced before, which is my proposal to the legislature on how I want to fund our government, places a special emphasis on workforce development, especially on our healthcare workforce. And we have a shortage of nurses that we've got to address. Just last week, I think it was last week, every day feels like a year nowadays, but I was in one of the most rural communities in Pennsylvania, up in the northern tier, think like along the New York State border, at a rural hospital talking about nursing shortages. Today I'm here in one of the most densely populated parts of our Commonwealth talking about what? Nursing shortage. This is an issue that's all across our Commonwealth and indeed all across our country. Hospitals across the Commonwealth report that 14% of their nursing jobs are vacant at any given time. That means our nurses are stretched thin. They're working double shifts, or they're covering more patients than maybe is ideal. And when we study this issue, and Secretary Walker has done a lot of work on this, The problem is only getting worse. That 14% figure is expected, to put this in practical terms, by 2026 to mean 20,000 nursing vacancies all across Pennsylvania. And so the time for action is right now. That is why I put my budget proposal forward. That's why this team here is working so hard to get it passed. And that's why we're here at Temple today, because we think Temple can be a model for the rest of the Commonwealth when it comes to how we invest in bringing people along into nursing and how we keep our nurses. My administration invested last year $2 million through the Department of Labor and Industry to create the first ever registered apprenticeship programs for nursing in Pennsylvania. I think apprenticeship programs are really important. I think it's critical in the 10th, 11th, 12th grade to teach kids the skills they need to go out and be successful. For a long time, apprenticeships have been focused on, say, learning how to be a welder or a plumber, and God knows we need more welders and plumbers. You know, we also need people who can be farmhands, work on our farms, and we desperately need more people who can be nurses. So why wouldn't we have apprenticeship programs that focus on developing more nurses with folks at an age where they look at that and say, that is what I want to be when I grow up? As a result of just that $2 million investment and the hard work in my administration, we now have 27 registered apprenticeship programs for nursing in the Commonwealth of Pennsylvania. We've also made it easier for nurses who have trained and worked in other states to practice here, because we joined the Nurse Licensure Compact alongside 40 other states. So if you're licensed in another state, you can now practice here in Pennsylvania. We've cut through the red tape. We've gotten rid of those bureaucratic hurdles that were making it harder. So with the apprenticeship program, we're helping create a pipeline. With this compact, we're helping bring more nurses in who have studied or practiced elsewhere. Well, listen, those are just two of the things we've done. We've done a whole lot more, but I also recognize there's a lot more work that we need to do, which brings us here. In this budget proposal, we're taking concrete steps to recruit more nurses to Pennsylvania and build on the foundation and to learn from institutions that are doing it right, like Temple. Temple is already doing incredible work in this space and started an initiative that we want to emulate and build up all across Pennsylvania. Let me explain a little bit more how this works. Hospitals know they need more nurses, so they partner with local nurse education programs to then offer guaranteed job placements to nursing students after they graduate, and they help them with their tuition along the way. Hospitals win because they get a guaranteed workforce of trained nurses that they can rely on, and nursing students win because they get their costs offset for their education, and they know they've got a path to success in the field that they love, and by the way, a field that we desperately need as a Commonwealth more people to go into. That is strengthening our pipeline. Maura, who you're going to hear from in a few moments, and you got to give her a big round of applause when she gets up. She's a little bit nervous, but she's going to be, you're going to be amazing, Maura. She's one of the first students to go through that program here at Temple. I want more Mauras across Pennsylvania. We need more people like you across Pennsylvania. And to that end, we're investing $5 million in my budget to build on the success of what Temple has built here and create a stronger pipeline like this all across Pennsylvania, so we have more Mauras across Pennsylvania. Listen, I want to focus just for a minute on another topic that is really important to us. As we develop these nurses, we need to make sure that we prepare nurses and really all healthcare providers with more tools to help women and mothers dealing with unique maternal health issues. That's why the Commonwealth invested $40 million in the construction of Temple Women and Health, the region's only hospital dedicated exclusively to women and families' health. This was a smart and sound investment that the Commonwealth has made. Improving maternal health is particularly important to me, to these representatives, and many others. In my first 2 years as your governor, we brought leaders in Harrisburg together, Republicans and Democrats alike, to make the first ever investment to address maternal mortality, and we doubled down on that last year to continue our Commonwealth's investment. This year I want to come back and tackle another issue that oftentimes lurks in the shadows. It's something you talk about here, but something we don't talk about nearly enough in our healthcare system across Pennsylvania. Something that impacts 1 out of every 8 new moms across the country, and that's postpartum depression. My budget includes new funding to help the Department of Health work with healthcare providers across Pennsylvania to, for the first time ever, implement universal postpartum screenings for moms. We want to train doctors and nurses and healthcare professionals on how to more quickly identify postpartum depression. We want to speed up the referrals to mental health professionals when a mom is diagnosed. And we want to create a resource hub where families can go to find more information, as well as local support networks for postpartum depression. You're doing so much of that work here at Temple. We need to lift that up and do more of it across Pennsylvania. We also, as part of this conversation, as part of a governor standing up here and talking about this, as part of these representatives promoting this, we want to end the stigma surrounding postpartum depression. Have an honest conversation about it and make sure that those 1 in 8 moms that are battling this get the help and the resources and the services that they need. I think as we close out here, I want to just really highlight this issue of workforce that we're focused on in this budget, particularly on workforce surrounding our healthcare workforce. I know that this is not unique just to Pennsylvania. This is something every state is grappling with. But I'll end where I began. We've shown in Pennsylvania an ability to solve problems, an ability to bring people together to tackle these big challenges, an ability to come together and see problems on the horizon and address them today so they don't become crises tomorrow. This is the next thing we have to solve. And Temple provides us with a great example that we can now lift up across this Commonwealth and make sure that we've got enough nurses, not just here in Philly, but all across Pennsylvania to deal with our healthcare challenges of tomorrow. So Temple, I want to thank you for being leaders in this space, and I want to thank all of you for being with us today. And I want to bring up Dr. Carter Short, who's been a great leader in this space, to talk more about the work that's happening here at Temple. Doctor?
Hello, everyone. My name is Chaudron Carter Short. I am the Chief Nurse Executive for Temple Health System. I am incredibly proud to lead a nursing team that demonstrates such dedication to our patients and to the nursing profession. Their work has profound meaning and impact on the lives of the patients that we serve. Here at Temple, we continuously partner with our HR teams on strategies to attract the best candidates to join our nursing workforce. That's why Governor Shapiro's Nursing Shortage Assistance Program is such an important step forward. This program directly benefits nursing students by guaranteeing them a position in an area of need and paying back their student debt while they train with a sponsoring health system similar to Temple Health. In return, students commit to working at their sponsoring institutions for 3 years after graduation, earning full salary and benefits. These hands-on model enhance clinical training, improves workforce preparedness, and reduce costly onboarding fees. Hospitals like ours will see significant savings by further decreasing turnover, cutting our reliance on staffing agencies, and optimizing patient care. Since our Temple's Nursing Scholars Program launched, we have found it to be a game-changing tool to plan for the future. In just a few months, we've received interest in the program from nearly 200 aspiring nursing professionals entering RN and CRNA roles from 18 partnering schools. From 18 partnering schools across the Commonwealth. In that time frame, we filled nearly 50% of our first year's quota. This initiative also opens up doors for aspiring nurses from all financial backgrounds, making education more accessible and affordable. By reducing student debt and addressing the root causes Pennsylvania's nursing shortage, this program is a wonderful investment in the future of healthcare. We are grateful to Governor Shapiro for including funding for this nursing workforce initiative in his budget, the first time ever at the state level. This investment supports recruitment and retention for our healthcare workforce and will further benefit those who matter the most, our patients. It is now my esteemed pleasure to welcome one of our Temple Nursing Scholar students, Mara Cabry, to the podium. Just a second.
Good morning, everyone. My name is Mara Cabry. I'm a nursing student at Jefferson and will be starting my professional nursing career this summer at Temple. I'm so grateful to be here and say thank you to Governor Shapiro for proposing investments in a nursing assistance program just like the one here at Temple, and hoping other nursing students can take advantage of it as well. As a nursing student, I spent a lot of time thinking about what it means to not only enter a profession that I am so passionate about, but also to do so with a sense of security and purpose thanks to the incredible support from the program. For me, this program has truly been a life changer. It has provided me with a unique opportunity to enter the nursing profession, not with just excitement and enthusiasm, but with a sense of financial peace. The burden of student loan debt is something many of us fear, but knowing that I have a position guaranteed here at Temple, with the added benefit of having my student debt paid back, has completely transformed the trajectory of my career and my life. It's not just a job, it's a commitment that frees me to focus on what truly matters, caring for patients and growing in this field. I am thrilled to be here joining Temple, a health system with such an incredibly deep commitment to its community. As I stand here today, I can say with confidence that the Nursing Scholars Program has given me more than just a path to my career. It has given me a sense of purpose, a deep connection to the community I will serve, and allowing me to become the best nurse I can possibly be. Thank you again for making this possible and for investing in my future and the future of healthcare. I'm excited for what's to come, and I can't wait to see what happens. Thank you so much. And now, Secretary Walker.
I said we need more Maras, right?
That is a tough act to follow. Thank you for sharing your story, Mara. And Michael, thank you so much, and for all the team at Temple for inviting us here today. This is such a warm welcome for such an important topic today. And Governor Shapiro, thank you for your leadership in workforce development. The governor has said this is his workforce budget, but in fact, the governor has been deeply committed to workforce since he started in his position. And the fact that he knows that it's not just about meeting workforce needs today, but also being able to meet the workforce needs of businesses and communities tomorrow is really so strategic and so key. As you've heard everybody say, we have such a workforce shortage in the nursing profession. In Pennsylvania, the demand for registered nurses every year is close to 9,000 people. For nursing assistants, that number is over 11,000. And for the home health care aides and personal care aides, we're talking about 33,000 people. This is really a crisis right now, and we have an aging population in Pennsylvania. So these numbers are just going to continue to go up over the next 10 years. So what the governor is proposing is an investment that would be able to empower us to make real changes that are going to be impactful, not only right now for our needs, but also as we look forward. This partnership that we're talking about today will really be a great way to invest in nursing schools and teaching hospitals so that we can align training and workforce needs to make sure that we're meeting the needs of localities. So whether it's an urban area or a suburban area or a rural area, we're able to meet the needs of the nursing profession in that area. The governor has put money in workforce development programs since he started in office. When he started office, since he started in his office, he's invested $65 million into vocational apprenticeship training and CTE programs across Pennsylvania. That's 50% more than the last administration invested, and he continues to invest. This is so important because places like labor and industry are able to do things like he just described, help to create apprenticeship training programs across the state. And since Governor Shapiro has taken office, we've added 40 pre-apprenticeship programs. So the programs that the governor was talking about that affect young people in schools and give them a trajectory into a career pathway, as well as 70 new registered apprenticeship programs. And again, these are earn-as-you-learn opportunities, so people can start in a profession and get paid while they're learning. So these are wonderful opportunities. And just in 2024 alone, we've increased the number of healthcare programs by 15%. So this is an incredible investment that the governor has made and continues to make. So this, again, is just another opportunity for the governor to show everyone how he is getting stuff done. And at the end of the day, it's about giving Pennsylvanians the opportunity to make choices. And choices are only opportunities when, in fact, opportunities exist. So thank you very much, Governor Shapiro. Thank you for having us here today. And I'll turn it back to the governor to answer some questions. Thank you.
Thanks so much. Good work. It is all about getting stuff done, and I got to tell you, the Temple's getting stuff done. Maura's getting stuff done. Maura, that was very impressive. I got to tell you, you should do this more often. Maybe. She said maybe. I'll be there to launch your campaign for you for whatever you run for. With that, Maura's actually agreed to answer any questions from the media. So if there's any questions from the media, we're happy to take a few. Seeing none? Yeah. I'll come back to you and say anything on this.
No, on topic.
Oh, on. Oh, yeah. There's a shock. There you go. Go ahead, John.
Now, like you mentioned during your speech that you were in Bradford County.
Yeah.
You talk about the healthcare worker shortage in rural Pennsylvania. You're talking about it here today in Philadelphia. Can you talk about the similarities and then the differences that rural parts of Pennsylvania and then urban parts of Pennsylvania are dealing when it comes to healthcare workers?
Yeah. Yeah, so here's something similar. We have a nursing shortage in rural communities and in urban communities. And so we've got to create a greater pipeline of nurses graduating, and we've got to make sure that they stick, right? They stay in those communities that are underserved. Here's an area where we've got a difference, but yet we've got to still tackle the problem on both ends. Here in Philadelphia, we have one primary care physician for every 222 Philadelphians. In Bradford County, where I was, you referenced before, we have one primary care doc for every 522 individuals. And if you think about it, in these rural communities, you got to drive a lot further just to get anywhere than you would in a more, closer urban setting. So we've got to make sure that while we're increasing the number of nurses, we're also increasing the number of primary care docs. And I've also proposed that we give nurse practitioners greater practice authority to be able to help reduce the sort of disparity when it comes to access. So a lot of similar challenges when it comes to not having enough providers, but it's particularly exacerbated in these rural areas where the ratios are just really unacceptable. We're also seeing more and more hospital closures in rural areas, and that's another thing that we have to continue to stay vigilant on and focus on. Thanks, John. Anything else? Yep.
Mine's a little off topic, but still healthcare, and you just mentioned it. I live down in Delco. I live near Crozier. Just visited somebody in the hospital there on Sunday, and everybody around there is worried about what's happening. Is there any update?
Yeah. Folks, I understand, are worried. I'm worried too. And I want you to know the Commonwealth has done a whole lot to try and address this challenge at Crozier. The Commonwealth, together with our county partners, have invested over $20 million to help keep that hospital open and continue to serve the people of Delco and the surrounding areas. Here's the problem we have with Crozier. It's owned by a for-profit entity that is a private equity firm. And I have called for the elimination of private equity or dramatic reform for private equity in our healthcare space. Why? Because what private equity does is they buy up these healthcare institutions and they run them into the ground while they put a profit in their pocket. And it is damn wrong, and it is hurting the people of Pennsylvania. That's why I know these representatives are taking the bill that I put forth and trying to move it through the legislature to get private equity out of our healthcare system. The private equity firm that's been running Crozier is called Prospect. Their executives are making money, and they're screwing over folks in Delco and screwing over Pennsylvanians. That is unacceptable. We have worked together with the Office of Attorney General to put a receiver in place to try and run that hospital and continue to keep that open for the people in that community. That's been important, and we're going to continue to work closely with the Office of Attorney General on that. But there's two other entities that have to have some skin in the game here. There is a foundation in Delaware County that literally only exists, only has money in its coffers from the original sale of Crozier from nonprofit to for-profit status. And this foundation is sitting on a whole lot of money that could help provide health care in Delaware County, and they're not doing anything with that money to actually help people. Instead, they're sitting back and they're keeping that money in the foundation's coffers. They gotta step up and actually do something. The county and the state have, the foundation has as well. And I'll say another thing. We also need our healthcare institutions in the Philadelphia area to step up and do more. Penn has to do more. Main Line has to do more. They're gonna have to shoulder the burden of where these patients are gonna go if Prospect does in fact shut down Crozier. So I wanna see more from this foundation that literally exists to help make sure Delaware Countyans have access to health care. They're not doing enough. And frankly, I'm sick and tired of how they keep hiding the ball and not stepping up. And these healthcare institutions have to step up as well. If you can't tell, I'm annoyed. I'm annoyed by the presence of private equity in our healthcare space. I'm annoyed that our healthcare institutions in the Philadelphia area aren't stepping up to do more. Instead of this problem landing on their doorstep, they should be more affirmative and step up and do more. I'm annoyed by this foundation. We're going to continue to work closely with the Office of Attorney General, who kind of oversees the overseer here, in making sure that folks in Delco continue to have access. It won't look like it does now, but we're going to do everything in our power to ensure that they continue to have access. It's critically important. This Crozier issue is not unique. We're seeing too many hospitals, especially in rural communities across our state, shut down because private equity stepped in and bought them. And understand what private equity does. They buy the healthcare institution. They basically split it in two, right? A real estate company, right, the land that's there, and then the operations, right? Think the hospital and the hospital functions. And they basically have the land company bill the healthcare company exorbitant fees, exorbitant amounts, so the land company gets rich and the healthcare part of it, the hospital part of it, loses money, can't care for patients, and eventually has to shut down. And who gets rich in that process? These private equity guys. It's wrong. It has to stop. And unless we do something about it in the legislature, in the governor's office, it's going to continue. I don't want to see private equity guys get rich on the backs of Pennsylvania patients. We got to change this. Yeah.
Hi, sorry, actually kind of related to hospitals closing. So the DHS secretary said on Tuesday during the hearing that any possible Medicaid cuts would be catastrophic for the hospitals. So if PA does lose that funding, it's more than $28 billion from the federal government that comes in here. How does the Commonwealth plan on protecting Pennsylvanians, the people themselves, and also the health systems here in the state?
Yeah, well, let me answer directly, but first I want to just set the table here so everybody understands. About a third of the funding that the Commonwealth outlays to provide health care, make sure we test our drinking water to make sure it's safe, things like that, that money comes from, about a third of it comes from the federal government. And this has been a relationship that's lasted for years and years and years. And by the way, this is not unique to Pennsylvania. This is how it works in other states as well. You cited that Pennsylvania gets about $30 billion in money to run our Medicaid system from the federal government. That covers 3.2 million Pennsylvanians. By the way, there's 13 million Pennsylvanians. Over 3 million of them are on Medicaid. Medicaid covers everything from your prescription drugs to paying for a wheelchair to, of course, your hospital visits when you're sick. And in Washington right now, the Trump administration is pushing forth a budget that would slash Medicaid, so apparently they can give tax cuts to wealthy folks. I'm not against tax cuts. We've cut taxes together 5 or 6 times for small businesses, for seniors, for families who are trying to afford childcare. But the idea that you would cut health care for poor folks, cut health care and place an added stress on your insurance premiums or on emergency rooms across Pennsylvania, across this country, makes absolutely no sense and is cruel and would hurt a whole lot of people. I'm hopeful that the Congress of the United States will actually listen to people who have been rising up and speaking up about how devastating these cuts would be. It would kill a hospital like Temple. I mean, they rely so much on Medicaid patients and the funding that comes from Medicaid. Your specific question was, how will the Commonwealth fill that gap? I don't know that we can. This is a deal that the Commonwealth and the federal government has made over years and years and years, applies in every state, and you can't be in a situation where the federal government pulls the rug out and says, hey, you're losing $30 billion, or you're losing a portion of that $30 billion, go figure it out yourselves. It doesn't work that way. The federal government made a deal to cover health care, and if they walk away from that deal, it's going to have a devastating impact. I've heard members of Congress in Pennsylvania embrace the president's vision here. Hell, they voted for the budget resolution last week that begins the process of cutting Medicaid. I don't know how any Pennsylvania congressman could vote for a budget that takes health care away from their citizens. And understand, of the 3.2 million Pennsylvanians, they don't just live in Philly. They don't just live in a different kind. They live all over our Commonwealth, in rural, urban, and suburban communities. These members of Congress are going to have to think long and hard before they cast their final votes to slash Medicaid, because it is going to have a devastating impact on Pennsylvania. Anything else? Yes.
On this topic of federal cuts, more broadly, do you have concerns about the type of contracts and businesses that have been targeted by DOGE specifically? And are you concerned about an economic ripple effect in Pennsylvania?
I mean, look, they froze $2.2 billion in funding that was promised to Pennsylvania, that was legally appropriated to Pennsylvania, and what did I do about it? I sued the federal government. I continued to talk to the Trump administration and try and engage them in dialogue, and I won. I got all of our money back to Pennsylvania, all $2.2 billion of it. I'm going to continue to stand up for Pennsylvania. I'm going to continue to stand up for Pennsylvania's interest, no matter who is trying to undermine them, if it's the federal government or anybody else. I'm willing to work with the federal government to help Pennsylvania, but if they do anything to mess with Pennsylvania, they're going to have to go through me. I got a pretty good track record of standing up to the Trump administration. Yeah.
Governor, on the trade conflict, Canada and Mexico obviously big trade partners for Pennsylvania. Is there anything the state can do to sort of offset that, and how concerned are you about the impacts that could have on Pennsylvania?
Yeah, I realize that international economic policy can be somewhat of a confusing topic, just like, the stock market can be confusing. Why does it go up? Why does it go down? On this, it is super simple. President Trump unilaterally pushed a button to begin a trade war with our two closest allies and our two closest trading partners that is going to jack up the price of goods for Pennsylvanians and also make it harder for our farmers especially and our businesses to get access to markets that they rely on every day. Canada, for example, is our largest trading partner, is the Commonwealth of Pennsylvania. Mexico is the largest foreign trading partner for Pennsylvania farmers. So when Trump decides to issue a 25% tax on Pennsylvanians, that makes cars cost a whole lot more. It makes all kinds of goods that we buy overseas cost more. And when you think about the impact on our farmers, for example, our dairy farmers sell a ton of dairy products to Mexico, it now means that the products that we make here in Pennsylvania on Pennsylvania farmlands that had been being sold to Mexico now cost 25% more in Mexico, which means the Mexicans are going to buy less, or they're not going to buy any at all because they can find it cheaper somewhere else. And who does that hurt at the end of the day? Not the Mexicans. It hurts Pennsylvania farmers. This is really simple. Donald Trump imposed a 25% tax on Pennsylvanians and is hurting specific industries in Pennsylvania like our farmers. When it comes to all of you, if you're in the market for a new car, whatever car you're looking to buy, it's got aluminum in it. The vast majority of the aluminum in that car comes from Canada. And now it's going to cost at least 25% more. We're looking at some estimates that suggest car prices are going to go up about $5,000. People can't afford that. I've been working with these guys here successfully to cut costs for Pennsylvanians. We tripled the child care tax credit. We cut taxes for our small businesses. We've been helping our seniors by putting more money back in their pockets than ever before. We need to cut costs. Heck, Donald Trump ran on the idea that he was going to cut costs, and the first thing he did was impose a 25% tax on Pennsylvanians. It makes absolutely no sense. I think it makes us weaker, and it harms us domestically.
Time for one.
Last
more
one.
question.
Yeah. Good, Jim.
There's one question about the state budget.
Yeah.
I know a few months ago you announced federal flex funding for septic.
Yeah.
To avoid service cuts and fare increases. What's the, I know right now the budget hearings are going on in Harrisburg. What's the baseline that SEPTA needs to avoid that? And would federal flex funding be on the table again? Should SEPTA not get what they need, or should the budget be late? Because again, SEPTA is dependent on
The budget proposal I put forth would meet the needs of all of our mass transit agencies across Pennsylvania, including SEPTA. I know these members here are working their tails off to get that through the legislative process. It's obviously going to require some give and take. I know that the Senate wants to see it paired up with more funding for roads and bridges. I'm absolutely for that. By the way, I'm proud of the fact that we repaired more bridges in Pennsylvania last year than any other state in the entire country. We should do more of that. So I'm happy to pair up funding for mass transit with additional funding to repair roads and bridges. This is a matter that's got to now be addressed by the legislature. I've put my proposal forward. I've been speaking about the need to fund mass transit for the last 2 years. I did, as you mentioned, flex funding to create a bridge to get us to this budget this year. Now it's in the hands of the legislature to find common ground on what I think is a critically important issue, not just for SEPTA riders in the southeastern Pennsylvania area, but for people who rely on mass transit in each of our 67 counties. Thank you all very, very much. Appreciate it. Thank you.